Namaste, Vanakkam, Swagatam. Welcome to this special session today where we are going to be looking at nasopharyngeal hygiene. This sort of came together because of last week's lesson. And last week's lesson highlighted the importance of this nasopharyngeal hygiene. And I felt a need that we explore it in a bit more detail rather than just let it go by. Hence, the video I've shared the other day with the practice. And today I wanted to share some important information on what we are doing, why we are doing, and what is the bigger picture. Let us invoke the Guru Parampara as we begin today's session. Om Tad Paramparaye Vidmahe Jnanalingeshwaraya Dhimahi Tanno Guru Prachodayate Om. Om Yogamaharishi Dr. Swami Gitananda Giri Guru Maharaj ki Jai. So we will start off by looking at a few concepts. We'll look at a few images and we will reread Swamiji's page on nasopharyngeal hygiene to put things in context. So I'm going to start off by sharing the screen, and here I'm sharing some pages from an excellent book that was compiled by Dayanidhi as part of the notes we hand out at ICYER for our certificate, PG diploma, and for the MPhil and also for the PhD students. And in this, I would like to highlight what we are looking at today, and that is the concept of the Shat Karma. The bigger picture of where all of this is coming together is in the Shat Kriya or the Shat Karma. These are terms you often find utilized by people in different contexts. The word Kriya Yoga is used in at least 3 different contexts. One is Maharaj's context of Tapas Swadhyaya Ishvara Pranidhana. That is one context. The second context is as the performance of the Shat Kriyas of Hatha Yoga. And you find the term Kriya and the term Karma used. And there's a nice 3-page handwritten notes that was shared by Udayji, and I have circulated to you, which highlight the importance of understanding a distinction there. The other place you find the word Kriya Yoga used is in the tradition of Swami Yogananda Paramahamsa and the Yogoda Satsanga, the Self-Realization Fellowship, where you have certain practices which are put as Shat, the Kriya Yoga, and similar practices exist. I'm saying similar, not the same. Similar practices exist in Swamiji's teachings, which are called the Laya Kriyas. And these are mental visualizations that are utilized for us to attune ourselves to the energy flows. If you notice the words I used, mental visualizations to help us attune to the energy flows. Because in order to understand the energy, you have to start thinking about them. In order to think about them, you need to visualize them. So the process is visualization to then take you into the experience. You don't stop with visualization. Most modern yoga made up practices end with visualization. They don't take you any place. Okay, they have a lot of visualization, but they don't take you any place because they are not aimed at doing that. So Here, when we use the word Shat Kriya or Shat Karma, 6 practices come to mind in the Hatha tradition. And these are absolutely in line. Many people say Ashtanga Yoga is different, Hatha Yoga is different. And you have people who fight with each other over it. What we need to understand is that the first of the niyamas of Maharishi Patanjali's Ashtanga is Saucha. Saucha is cleanliness or purity. The body needs to be pure, the emotions need to be pure, and our intent needs to be pure. Unless purity exists, the divine doesn't have a nice place to come and stay, okay? If you're going to invite a guest to your house, make sure it is clean, okay? So if you're inviting the divine, make sure the body, mind, emotion, the spirit complex is as pure and clean as possible. So through Saucha, Patanjali gives 2 sutras for Saucha, not for the other niyamas and yamas, 2 for Saucha. Swanga Jugupsa Paraiva Satsangaha Samsargaha. He says, you stop getting caught up with your body because you have purified yourself to such a level, you transcend the body, you go from Deha to Videha. That is one of the most important aspects of Saucha. And you are not caught up with someone being clean or not clean because you have transcended all of that. Paraiva Samsargaha. But then there's the other one, the second verse, which is so beautiful. Saumanasya Ekagraya Indriya Jaya Atmadarshana Yogyatwanicha. That is, you develop a very beautiful sense of cheerfulness. You have a very beautiful sense of upliftment. See, there are 2 words, Saumanasya and Dhavamanasya. Dhavamanasya is depression. Saumanasya is the opposite of depression. It is to have a healthy mind that comes into your life, and your whole life is having a very beautiful sense of natural positivity. Not this modern artificial positivity that becomes toxic. And you have a lot of people with what they call toxic positivity these days. No, we are talking of natural positivity. A very beautiful, natural sense of ease about you. Saumanasya. Ekagraya, you become fit for concentration. Indriya Jaya, you attain mastery over the senses. And Atmadarshana Yogyatwanicha, you become fit to have a vision of your own self. Atmadarshana, you have to become Yogyat. You have to become Yogyata. You have to be worthy of witnessing the self. All is through Saucha. So one of the levels at which Saucha manifests is through the Shat Kriya or the Shat Karma. Just to put it in the context, these are the internal cleansing practices. See, externally you have a bath, you wash your hair and all. That is one type of mala. But the internal mala is the toxicity. Mala is that impurity that is blocking the flow of energy. That is why the Shatkarmas are needed if your channels, your nadis are blocked. Even Swatmarama says if your nadis are not blocked, you don't need the Shatkarmas. But you don't find too many people like that. People have total clogged up systems. Now, if your system is not clogged up, prana will flow. But if your system is clogged up, nothing will flow, let alone prana. So to assist the process of prana flowing through the nadis, even before nadi shuddhi, you have to do mala shuddhi. Because if the mala is there, no prana is moving, let alone doing a shuddhi. And this is why these practices have been considered as preparatory practices for pranayama. And the reason is, if prana is to move in the pranayama, your subtle energy channels, the nadis, must be clean and clear and unblocked. So in the Shuddhi Kriyas, you have practices to clean the eyes, the nose, the teeth, the tongue, the oral cavity, and the whole gastrointestinal tract. And if you look at the Hatha Pradipika, it says, Dautir Bastir Tatha Netis, Tratakam Naulikam Tatha, Kapalabhatis, Chaitani, Satkarmani, Prakash Chayait. Dauti is the first one, Basti, Neti, Trataka, Nauli, Kapalabhati. So these are the 6 classical cleansing practices. Dauti is to clean the upper gastrointestinal tract. Basti cleanses the lower gastrointestinal tract. Okay, so Dauti for the upper GIT, Basti for the lower GIT, Neti for the nasopharyngeal region, Trataka for the eyes. And Trataka is not just for the eyes, it is a preparatory practice for dharana and dhyana. So it's not just a shatkarma, it's a shatkarma, but it is also a preparation for dharana dhyana. Nauli is for the middle part of the abdominal region, the middle GIT. So Dauti is upper GIT, Basti is the lower GIT, Nauli is the middle GIT. All 3 of them together are for the GIT. 3 out of 6, 50% of the shatkarmas are to take care of gastrointestinal health. No wonder Indian systems of medicine say all disease comes through the digestive system. If your digestive system is normal, most of the diseases will not be there. That is the wisdom of Indian traditional healthcare systems. Kapalabhati, which has become sort of a chest cleanser in these days, it is actually to clean not just your chest. The side effect is your respiration improves. The kapha comes out. But the main effect of Kapalabhati is Kapala. From the name itself, it tells you it is to activate what's in your skull. And inside your skull, you're supposed to have a brain, and that brain is supposed to be functioning. Okay? Now, you often wonder whether for most people it is functioning or not, and that is an unkind statement. But seriously, we seem not to use this most important hardware that we have in our skull. You want to rid it of all the cobwebs. You want to clean out all the blockages in the nervous system, the central nervous system. You want to cleanse all the impurities, and you want the whole neuronal system to be functioning at its optimal level of health. And that is where Kapalabhati is the skull shining practice, where you actually, the light bulbs come on in your nervous system. You know, in cartoons, you always have this character, he has an idea and suddenly a light bulb comes on. That's what happens with Kapalabhati. Okay, and later on in yoga, step by step, towards the end, Swamiji will introduce how this actually works on this. All of these practices are to balance, harmonize the three dosha, Vata, Pitta, Kapha. So the concept here is where you find that Hatha Yoga bridges here the concept of the doshas, which is predominantly a concept of Ayurveda, and it is bridged here with the system of cleansing. You want to balance the doshas, and you'll find a lot of this how these different practices, the shatkarmas and the pranayamas, many of the asanas and mudras, how they are working on balancing the doshas. The dosha system is a very important fundamental system in understanding Indian traditional healthcare systems. It's a very important foundation, the doshas. Now, these powerful techniques were never meant to be learned from books or people. Yet nowadays, everybody has become a kitab guru, a book guru. And it's pathetic the way these practices are taught, as if, you know, anybody can do it any way they want. And today I had a person who phoned me about his health issues, and I had to actually put the phone down. I never do that much with anybody. I had to put my phone down because He just wasn't willing to understand how his practices needed to be worked on by him. And it was just after some time, I just told him, I'm sorry, I am not the person to help you. I don't do that much, okay? And it really drove me to such a point. I said, I'm just not the person to help you, because one has to understand these are not things you just pick off the net. These are not things that you just do like that. Now, when we do the Shat Kriyas, there are general benefits. One is that all the inner tracts, the optical pathway, the respiratory tract, the gastrointestinal tract, the nasopharyngeal upper part of the respiratory tract, they are all cleansed and refreshed. And inner awareness is developed. Another good thing that happens is people have hypersensitive reactions, allergies. This desensitizes those hypersensitive. You have to be careful with the word here. Desensitizing, not the normal sensitivity, but the hypersensitivity. It is a negative of the negative. Desensitizing the hypersensitive reactions, which is why these practices are so useful for people who have different type of allergies. It builds stamina and focus, and it prepares the sadhaka. Never forget this. Prepares the sadhaka for the higher aspects of yoga sadhana. These were not just done for the sake of cleansing. You are cleaning for the sake of something higher. And so you have Dauti and all of that, which is not our focus today. You have the Vastra Dauti and all of that, Danda Dauti, Basti and all. But our focus today is actually on the Neti kriya. And Neti is traditionally the practice of cleansing this nasopharyngeal tract with liquids or thread. So different type of liquids can be used, or the thread. So normally when we talk about Neti, we say Jala Neti. Jala means water. So cleansing with water. When we say water, it is lukewarm saline. And lukewarm saline means you have boiled the water, let it cool down, added the salt, and then you are using it. So it is taken very clearly that you have to boil it. On the Facebook group, I shared some recommendations from the FDA on that, and it's very clear it should be boiled, previously boiled, not using direct tap water. They are very clear about that. I think it's a very good warning to give people. Sutra Neti. Sutra means a thread. So traditionally, a thread is used with beeswax. Nowadays, it has become a catheter. We take a small urinary catheter, rubber catheters, and use it because it's much easier. The cleansing is less compared to the thread. The thread with the beeswax, when it is, twisted, it really pulls things out, okay? It pulls the whole nose out. And that's actually what happens. The catheter doesn't pull it so much out, but it opens the passageway. Dugdha Neti. Dugdha in Sanskrit, Dudh in Hindi, is irrigation with milk. Now, you know something. This may have been one of the therapeutic practices to break people of milk allergies. Nowadays, we have a lot of this talk about milk allergies. This may have actually been a practice that was used therapeutically at one time. Now, what I'm saying is hypothetical, but it is worth looking into. Grata Neti. Grata means ghee. So you take the ghee, and the ghee is melted till it is liquid, and it is used. Now you will say, why should you put ghee up your nose? There is a medical condition called atrophic rhinitis. The nasal membrane goes into atrophy. It gets destroyed. And the person ends up with a totally dry nose, and they lose the sense of smell because of it. Atrophy. Okay? A-T-R-O-P-H-Y. Atrophy. And the nasal mucosa inside the nostrils atrophies, and it leads to complications. Now, in such people, Grata Neti is an excellent practice to create lubrication in the nasal mucosa, and you can actually start to go against this process by bringing in liquefied warm ghee. So there is a specific therapeutic use. This is where the Hatha practices very much were geared into therapeutic practice. There were therapeutic applications that were given. And so they would say, if you are, especially kapha, most of the neti is based on anti-kapha. This is how you would classify neti, usually anti-kapha. But when it comes to some of these conditions, you start to think about it, because a dry mucosa is not really kapha anymore. It is more a pitta condition. Though it is still the nose, though it is still respiratory, because there is atrophy, it is more a pitta burn up of your tissues. And that is where the ghee starts to give a lubricant to it, and it starts to work against it. These are very beautiful practices. You then have the practice called Jala Kapalabhati, where they use the water, and you have the Vyutkrama and Sitkrama, where you take it in the nostrils. This is what we were doing the other day. What Swamiji actually suggests is where you actively suck the water from the palm through the nostrils, and either you let it out through the nostril or through the mouth. So you bring it through the nose into the mouth, or you can take the water in the mouth, bend forward, and you force the water to come out your nostrils. Many times when you're having a juice or a cup of coffee or tea, you sort of have, a sudden thing happens, you're talking or something, and you have this come up through your nose, and you have coffee come out your nose, or tea or juice come out your nose. Well, you can always say you are doing these Kapalabhati practices. They are called Kapalabhati, but they are more a Neti. So we have talked about the warm saline, and as I said, 1%. Check which nostril is flowing, perform Neti on that side. Whichever nostril is open, if you start on that, most probably the first round will be successful. You will gain confidence, and then the more blocked nostril you can tackle. If you start on the blocked side, it may be flowing, and then you get upset. The more upset and tense you become, the less productive you're going to be. And again, as we said, we put it in, tilt the head. Now here, I'm giving you a few anatomical suggestions. Tilt your head forward, downward, and sideward. So the head is forward, downward, and sideward. And this is how you align the whole passageway, so that when you pour the water into one nostril, it has a clear pathway to come out the other nostril. Because unless you bend forward, downward, and sideward, that flow will not happen, and you'll have water coming out the same nostril, coming out the mouth. It will not be coming out the opposite nostril. So bend, tilt your head slightly forward. So forward, downward, sideward, depending on which one you are doing, and you let it flow. Then, as we said, after that, the most important part is to blast out the air in the nostrils, and by doing that, you clean the passages of the remaining water. Many people forget this blasting out. And we have suggested the Anunasika that was introduced in the last lesson can be used for this. Now, this also goes into Sutra Neti, where you can use the thread or the catheter. But here you put it in the nostril and bring it out the mouth. So you have a catheter going in the nostril, out the mouth, and then, you do this type of stuff. People put it in here, take it out here, they do all sort of acrobatics with it. That's fine. But the Sutra Neti is a little more difficult, but it is a very, very useful practice if you can get to do it for so many of the nasal allergies and sinusitis. Sutra Neti and Jala Neti, amazing, amazing practices for that. And as we said, Vyutkrama, what we do is that you take the water in the nostril and out the mouth, whereas in Sitkrama, you take the mouthful of water and you bring it out the nostril. So I just wanted to give you this idea here. Again, a caution, Neti Kriya should be followed by few rounds of Kapalabhati or Anunasika to keep the nasal passage clear of any stagnant water that may cause problems later. Now, why do we use the salt? The addition of salt ensures the osmotic pressure of the water is equivalent to that of the body fluids. This minimizes the irritation to the mucous membrane. If a painful burning sensation is felt, it indicates there is either too little or too much salt in the water. And this is why what we usually suggest, it can be done in the beginning, then tolerably warm water and temperature can be reduced to ordinary cold water later on. That is, if the water is purified and safe. The idea using hot water followed by cold is to acclimatize the mucous membrane to the changes in the environmental air. So this is another approach you can do if you want to do it, if you want to avoid frequently catching cold. And, definitely over a period of time, the person doesn't need the salt. They could come into plain water with the salt. It could be possible, but that's again each individual's thing. Now, the very important point I wanted to highlight today here, not just the nose, not just the sense of smell, all the 5 jnana indriyas are purified, cleaned, and activated by the Neti kriya. When we talk about this, we are talking about the 5 common senses. That is the eyesight, the smelling, the taste, the touch, all of these, and taste, touch, smell, and the hearing. These 5 special senses, they are all purified. And I'm going to explain how this happens, because it's not just for the nose. It's for all 5 of them. It is a good preventive measure against cold, cough, sinusitis, infections of the respiratory tract. Anybody who suffers asthma will tell you that it usually starts off with a nasal infection. A running nose, sneezing is where it starts, and then it goes down into the lower respiratory passage, and then the asthmatic attack occurs. So if you can shortcut it going down and stop it right at the nose, you can actually prevent many of the asthmatic attacks from occurring in so many people. So it's an amazing practice in that way. It has a cooling, soothing effect on the brain and is beneficial. Now, this term is nowadays called conversion disorder. We don't call it hysteria anymore. We call it conversion disorder, epilepsy, temper tantrums, migraine, and depression. These are conditions that are related to neurological and mental health. They are like conditions that sort of are in the gray area between neurological and mental, psychoneurology, all these conditions. They are not just pure neurology or pure psychology. They are in between. And that is why this practice actually can help people a lot. It helps to overcome addictions, especially to tobacco and alcohol. Because most addiction is related to a very primitive sense, which is smell. Smell is the most primitive sense we have as a living being. And addictions are going right into that primitive sense. So when you work here, you are actually breaking some sort of cycle. You are breaking the pathway that is coming in there. It has a positive effect on the master glands of the brain, the pituitary and pineal. You can develop intelligence, eyesight. They say you don't get gray hair or wrinkling of skin. Typical hyperbole from Hatha yogis who will like really go out and say you look like the Cupid himself. That's actually what they say with many of these practices. They'll say you look as handsome as Manmatha, Kamadeva. These are the type of sentences you get. Removes the mucus and dust particles, prevents respiratory tract diseases like asthma, pneumonia, bronchitis, and who knows, if you can get things when they are in the nose, maybe pulmonary TB also. It is actually a very, very interesting one. And I must tell you that tuberculosis, the bacteria, is called Mycobacterium tuberculosis. Mycobacterium, it's a special type of bacteria called Mycobacterium. It is the same family of the bacteria that causes leprosy. Mycobacterium leprae. So Mycobacterium tuberculosis and Mycobacterium leprae belong to the same Mycobacterium family. Many people don't realize this. Where does the Mycobacterium leprae love to live? The nasal cavity. Mycobacterium leprae loves to live in the nasal cavity, and patients of leprosy, they have nasal cavity filled with the lepra bacilli. And this is why there have been some studies that have shown nasal irrigation with normal saline can reduce the load of lepra bacilli in the patient of leprosy, which then can help the drugs work better and help cure the condition better. Nowadays, many people have not seen or heard of leprosy. Even when I was doing my medical training, we saw quite a few. I grew up in Pondicherry, where on the main street, you had hundreds of patients of leprosy on the street. And it is one of the big changes that has happened in the last 2-3 decades in India is the virtual eradication of leprosy. People are not talking about it. Huge. And where I studied, Vidarbha was filled with leprosy. In fact, Vinoba Bhave, one of the great Gandhians, he set up the ashram in Varda along with Gandhi. He suffered and died of leprosy. And there were a lot of the issues. So they have a huge institution for leprosy patients. We used to go there as young medical trainees. And so that is why my interest came into this field. You can reduce the bacterial load. Same thing here. Where do the people get the tubercle bacilli from? Through the nose. Where do you get COVID from? Through the nose. You know, again, the same basic thing we are talking about. Cleansing your nostrils, cleansing your nasal cavity, you are strengthening your first defense mechanism. Your first defense mechanism is being strengthened. Now, when you work on this, and as I show you some diagrams in a few moments, you'll realize how much this is related to the Ajna Chakra. And you are actually starting to lighten up the Ajna Chakra from within. It, in general, purifies the structures in the head and the neck, and not only clears the nasal passages, but renders the nose resistant to many irritants like water, cotton, rubber, ghee, milk, and reduces the hypersensitivity in people having allergic rhinitis. And it is said your vision becomes subtle. Now, you know, these are quite amazing benefits that we are talking about. And you say, doesn't it seem to be too much for a simple practice like Neti? Well, if I now start to show you some images, you're going to actually see how this is true. Give me one moment. No, okay. I need to do it in a different way. Okay. Yeah, I think this image will now be good. If I share screen, perfect. Okay. Can you see an image now here? Yeah. So if you look at this image, you will see that here we have the normal sinuses. Now these normal sinuses, if you look at them, you will see that you have the nostril, the nose, and you have the maxillary sinuses on either side, these big things here. You then have what is called the ethmoid sinuses here, just along the inner aspect of your nose. And you have the frontal sinuses up here. This is where when you have a sinus headache, normally you have the real pain is up here. It's the frontal sinuses. Now you would have to go to the side view, and hidden under that you have what are called ethmoidal sinuses. So this is the ethmoidal. Then inside, deep inside, you have the sphenoid. So you have the ethmoid, the sphenoid, frontal and maxillary. Now these sinuses, they easily get infected. And when they get infected, we start to have problems. And you can see here an image of what happens. Can you see this new colored image? Okay. So here you see the same sinuses on this side. And here you see what happens when they get inflamed. The red and the yellow signifying the inflamed, and the yellow is basically the fluid that sort of starts to accumulate there. Okay. Now, if you look at this image here, you will realize why we have a problem with sinusitis. You know, anybody who were to, well, any decent mason, okay, any decent mason or any decent plumber knows that your drain outlet, your outlet drain should be at the lowest point of the floor. Okay, so if you have a bathroom, you want the outlet drain at the lowest point. If you have a sink, a basin, you want the outlet at the lowest point so that there is efficient drainage. Recently, we had a mason repair one of the samadhis for the guru. And this put the drain on the highest side. So whenever we now do the water ceremony, the abhishekam, we have to then push the water over the side of the floor because this guy created a floor that slants to the left with the outlet on the right. Okay, so it's just astonishing. And when I asked him about it, he's like, so what? Huh? I'm like, okay, fine. You just didn't do a good job. So what? Pay me what I need to be paid. And now I have to, you know, I said, okay, fine. When we rebuild that samadhi again, I'll set it right. And for now, you know, we have to push the water over the side of the samadhi because he didn't do it. Well, you know what? Nature has done that same mistake here with the maxillary sinus. Can you see this outlet here? You see this orifice of the maxillary sinus? Do you see where it is? Up here. Can you see my pointer here? And now look at the bottom of the maxillary sinus where it is. Do you get my joke about what has happened with nature? Nature, the maxillary sinus, the bottom part is down here and the outlet is up there. Nature's been a horrible plumber in making the maxillary sinus drainage. And this is why we humans suffer so much of maxillary sinusitis. Because their sinus cannot drain. Okay, now you know something. One of the hatenas, one of the practices we do for the Adhyam Pranayama, the upper chest, is Balasana. Nikunjasana, you lie down like a baby and you turn your head to one side for a few breaths and then turn your head to the other side for a few breaths. Can you see what is happening at that time? Why a baby goes into that position? Because the moment you do that, you have just turned this image. Let me see if I can do that. 1 second. Can I? Just give me 1 second. I'm really doing something which I don't know whether I should do. Okay. Imagine this now. Can you see what has happened? Now you have the maxillary sinus here and now the drain is here. When you tilt your head to one side, now this can drain, and then you tilt your head to the other side, and now this sinus can start to drain into the nasal cavity, and you can, 1 second, yeah. And what you can do is, you can actually decongest your sinuses, and that is why babies go into that baby Nikunjasana or Balasana, because they decongest the sinuses when they do that. Can you see the logic that is there? And this is why after you do the Jala Neti, it is important to turn your head and do some blasting on either side to get that drainage out. Now, if you don't turn your head, you're not going to get that drainage out. It's going to be stuck there. This is a very important thing to keep in mind when you're doing this. Remember, bend forward, downward, and sideward. Forward, downward, and sideward. And suddenly, you have rectifies nature's plumbing mistake. Okay? This is how these practices work. Now, the second thing I want to show you here is the eyes. You see eyes here? They drain into this part of your nasal cavity. The lacrimal ducts. You know, when you have tears, you can actually start to taste your tears at times. Or, you know, you put nasal, eye drops. And after a few moments, you taste it in your nose. Because the eye drainage system, the lacrimal duct, is connected to the nasal cavity. And this is why often the nasal cavity, the opening of the lacrimal duct is blocked, dehydrated, and clogged up. When you do the Neti, you are unclogging the nasolacrimal duct, enabling the eye and the nose to be once again connected very effectively. Again, so the eyes, the nose, again the frontal sinuses also drain here. And this is why when we do the Neti, we are working on decongesting all the sinuses. But I want to remind you what happens is you see your nasal cavity, the wall is fine in the center. But here you have the inferior and the middle and superior terminates. They are called turbinates. So here is the superior turbinate. Here is the middle. Here is the inferior. And in this, you see this, how there's this gap here. That's why they are called the nasal concha. They are like the conches. They conch in your nose. And this is why when you do Neti, water will go and hide in these corners. Water will hide in these corners. And if you don't blast out, if you don't tilt your head, if you don't bend down and up and do a few different movements, water stagnation in this will then lead to infection. And then the ENT surgeon will say, Neti is not good. Yogis are doing Neti and causing nasal infection. And not just a nasal infection, as I'm going to tell you, it connects to the back of the throat. And in the back of the throat, what do you have? Let me see if the next image has that. Just to give you another image. One second. Just give you one more image here. Can you see this image? It's a bit frightening if you don't know what you're looking at. But again, you can see the nasolacrimal duct, how it is coming. And again, you can see why we have a problem with the drainage here. Okay. Again, you see when it's inflamed, what happens? The frontal sinuses and the ethmoid, the sphenoid. And do you see how the fluid is going and stagnating in the maxillary sinus here? And this is why the drainage is so important. That is why the Balasana, Nikunjasana is so useful when you are doing this. Yeah. Now, this is what I wanted to show you. Oh, the image is quite big. Now, this is the connection between your back of your throat. Now, see, this is the side version. So this is your nasal cavity with the turbinates. This is your oral cavity. And here you have, if you look here, you'll see the small thing. This thing in the back here is the eustachian tube opening. So it's right in the back of the throat. The eustachian tube opening in the back of the throat, it connects to your middle ear. Okay, this is the diagram of your middle ear. This is the outer part of the ear. This is your eardrum, okay, tympanic membrane. This is where you have those bones, stapes, incus and malleus, stapes and incus. And here, this is the internal ear. This is the middle ear connected by the eustachian tube. So the eustachian tube from the back, the eustachian tube from the back of your throat connects to the middle ear. You say, so what? Well, it means if you have a throat infection, that infection can go up through the eustachian tube into your middle ear, and you end up with pus in your middle ear that then creates a pressure and ruptures your eardrum, and then the pus comes out your eardrum and it heals on its own, or you need antibiotics. If this keeps on happening, it becomes chronic otitis media, and if that happens, your mastoid behind your ear gets infected and you end up like me. I had so many repeated infections in childhood from going in water, dirty water, and swimming all the time, that I have ended up getting half of my, not really half, more than half of my mastoid cavity cleaned out by the ENT surgeon, and had to be cleaned out because there was this chronic infection coming. Tonsillitis is the other one, the tonsils in the back. They are spreading it. And this is why when you do Neti, you are not just cleaning the nose, you are cleaning the nasopharyngeal region. And if you start to do Sutra Neti on top of that, the whole back of the throat region is cleansed, mucus is removed, blockages are removed, and you know, for the first time, proper aeration, which means air going into that area. Your eustachian tube will start to have healthy air moving through it, and the healthy air coming in through the eustachian tube will help the middle ear be healthy and have a good sense of hearing. And that is why after you do the Neti, Swamiji suggests, you know, what he calls Karna Mala Dauti. Karna is the ear. That you hold the nose and you sort of try to sneeze into a closed nose. You then send that pressure, opening the eustachian tube into the ear. And then from outside, you cup your ear and you do this, balancing the internal and external pressures. And suddenly you hear about 20-25% better than you were hearing before. The same experience when you come down in a flight and your ears get blocked up, and then, you know, you close your nose, or you suck on a sweet chocolate or whatever. They used to give those in the airlines. They even stopped that budgetary cuts. At least they used to give these nice toffees as you were landing. They stopped doing that also. And it was a very nice imli. Imli means the tamarind. Tamarind sweet used to be given on Air India. And they stopped that also. I used to love that. You know, the whole flight you were looking forward just because at the end of it, you got a nice sweet as you were landing, and they stopped it. The reason is when you work on this region, you're opening it up. So when you do the Neti, you are not only working on your nostrils, cleansing the nostrils, enhancing the sense of smell, you are also going to clean the tongue, because part of the process is the tongue cleaning after this with all the mucus, especially if you do Sutra Neti. Oh my God, the mucus will just come off your tongue and come off. And then do a nice tongue scraping. Jivha Mala Dauti. Jivha Mala Dauti is cleansing the mala, the impurities on the tongue. Okay. Then, so taste is improving. Remember, your ears open, your hearing improves. Your eyes are being cleansed. Eyesight improves, and there is the lightness of your whole face. The sense of touch improves. So touch has improved, smell has improved, sight has improved, hearing has improved, and taste has improved. All the 5 Jnanendriyas are being brought into their optimal functioning by the practice of Neti. Not just Jala Neti, also the Sutra Neti in that case. So this is another diagram I wanted to share. This is another one showing you how the eustachian tube is connected. This is the outer ear canal, the eardrum. So you can see how we are taking advantage of this and utilizing it in a positive way. And this is where all the 5 aspects of the senses, Twak, which is related to the skin, Chakshu, the eyes, Shrotra, the ears, Grahana, the nose, and Jivva, the tongue. All the 5 Jnanendriyas, they are being brought into optimal functioning by the practice of Neti. That's one of the very important aspects that I wanted to share with you there. Just give me 1 second. I'm checking up on something here before I go ahead. Yes. So when we are doing the Neti, it is very important that the most important part, what happens is that all this modern, I told you how modern pharma mafia has sort of infiltrated all of this. And so they talk about nasal saline and they have all these syringe bulbs you can do and all. See, the syringe bulb stuff, just think about it. Okay, I'm just going to give you a perspective. When you can actively yourself govern the flow of the water through your nose, do you want an external pressure that is going to push the water up your nose? You don't know what it's going to do, where it's going. It's again that pharmaceutical mania that they suffer from. It has to be done in the extremes, okay? You just need a gentle trickle of the water through your system, not this, it's like boom. See, when I'm teaching you, I have to teach like that. All of you have to listen to me because you'll put off your computer and go out of the class. You know, pharma mafia wants it all to be, because it has to be in your face, okay? So see, there are people who need it, okay? There are therapeutic indications for that. But it's being sold over the counter. It's being sold in a way and marketed as if, it's the new big thing. I'm like, Neti has been around for thousands of years. Do you guys even know that? And I told you about how salt water is sold for about 1,000 or 2,000 times its cost by these guys just packaging it in containers. And then our Indian yoga gurus who get into it. You can have sanctified water from the Ganges, blessed by Puba, great guru. Most probably it's somebody's tap water, okay? We have jokes about Ganga Jal in India and how people, they just fill up containers with tap water and then put a label Ganga Jal because nobody knows where that water is from. When I went to Haridwar and Rishikesh with Naveenji a few years ago, we were talking about going down to the Ganga and having our sna, our bath. And Naveenji said, Dr. Ananda, just putting on your shower here, you're already bathing in the water of the Ganga. Because you are right on the banks of the Ganga, the groundwater that you are getting through the shower is the water of the Ganga. You actually don't even need to go down to the Ganga, because even your shower bath water is Ganga Jal. It's a very, very interesting one. Lot of stories on this. And special blessed Himalayan salt. See, I'm not joking. These are in advertisements. Go and look at the slick yoga magazines in North America and you will find these advertisements. I have seen them. Special blessed Himalayan salt for your Jalaneti. Seriously, we just have to make a business out of everything. We just have to sell our soul for 13 pieces of silver. 30, sorry, was it 30? Yeah, 30. At least he got a good bargain. We are selling it for plastic, not even silver these days. I tell you, what we have done is such a criminal offense. You just need boiled water with salt, whatever salt you have. Find a container, and start doing it. This is the basic bottom line there. I just want to address if there are any questions before I go on to sharing Swamiji's points on this. Yes. As we said, yes, COVID, there is the thing, and I have mentioned Jala Neti to keep safe from COVID. It has been one of the practices I have made part of my more regular practice in the last year. I will say that we still have a mammalian nose. Very true. Many people have that. And Sri Devi asked a very pertinent question. Was the outlet okay when we were still on all fours? Absolutely. And I think this is one of the issues we have, is the human body was actually designed for all fours. And then evolution pushed us onto 2 feet, and many things didn't get rectified. Our spinal column is one good example of that. The pelvic floor is another good example. Reason why we have so many problems with the pelvic floor and the human spine, the varicose veins, the blood vessels in the lower part of the body had to change. And that's a very good point. On all fours, the outlet would be very, very different. Think about how a cow or a goat would have to graze, and you'll see that it's naturally in a position where there would be a drainage of the sinuses. It's quite interesting, actually. That was a very beautiful point, Sri Devi. And yes, does Neti help with tinnitus? I would say yes, because again, if you look at the whole process, tinnitus would be described from a yogic perspective as an imbalance of the cranial nerve related to audition. So the 6th cranial nerve, vestibulo cochlear nerve, is the nerve that is responsible for carrying audition to the brain, as also balance. The cochlear part and the vestibulo. The vestibule is one, the cochlear. So it has both functions. One is the hearing, audition. The second is balance. That is what the internal ear, not the middle ear, the inner ear does with semicircular canals. It does the balance, which again improves when you do 4-footed Chatushpadasana and Balasana. Again, the same thing for that also. Now, this has got an imbalance. That is the yogic perspective is tinnitus is an imbalance of this neuronal connection. Hence, practices like Neti that are working towards creating balance in that system should help. So yes, I would say it would help. I would suggest doing the 4-footed postures, Balasana, and also the Brahma Mudra is an excellent practice to do for practices like this. Definitely an Anunasika. Bring in the Anunasika because it will also help a lot. Okay, chewing gum, yes. That is what used to often be given because of that movement that's in the back. Soundarajan has asked a question about the Jnanendriyas and the Pancha Pranas. I would say there is not a direct connection, okay? It would be a bit hopeful that there's a direct connection. We would have to look at indirect connections, because if you understand the Pancha Prana along with the Tanmatra, I think the key here, this is a little technical, but I'm just going to go into it for a few moments. The Jnana Indriyas, for example, sight is through the eyes. So the process of seeing through the eyes has an organ of perception, okay? Organ of perception, Jnana Indriya, and that which it perceives, which is called a Tanmatra. So Tanmatra is that which is perceived through the Jnana Indriya. So through the eyes, you are perceiving form, Rupa. So Rupa is form that is perceived through Chakshu, the eyes, which are the Jnana Indriya. Now these are also related to the Panchamahabhuta. For example, smell with earth, taste with water, seeing with fire, hearing, touch with air, and hearing with ether. This is how the connection goes. Now the prana vayus are also connected at that way that the apana vayu, the apana vayu is related to the first two elements. So it's not a direct correlation. Apana vayu is connected to earth and water because Mooladhara and Swadhisthana are connected to apana. So taste and smell would be connected to apana vayu. So this is how Soundararajan, you would have to create a cross connection of concepts if you want to take it. So I would say that's an interesting perspective. Thank you for bringing that in, that through the Neti, you are not only working on the Jnana Indriyas, but also maybe the Pancha Prana Vayu. Because especially when you talk about Prana and Apana, similarly, Samana is the gastric fire and is related to the fire element, so the eyes. So you are having an indirect connection. People will say, what do the eyes have to do with digestion? It's a bit tough to explain that, you know, physiologically, but metaphysically, metaphysiologically, there's a lot there. So just to keep it in mind. Is there a chance of water clogged in the ear? Absolutely, yes. See, what happens is that we need to have a certain level of self-awareness to do these practices, which is why you don't just take somebody into a yoga class and immediately say, okay, let's do Jala Neti. It's not the way you approach it, because the person needs to develop a certain awareness of the self so that when the water is flowing, they know where the water is flowing to. So that, you know, they tilt the head so that the water is flowing out. But often you find people, after all this explanation, they will put the head in such a backward tilt, all the water goes some other place. And yes, you could end up theoretically having water go up through the eustachian tube and create a middle ear infection. I think in our Facebook group, Laurie has pointed this out by an ENT surgeon, that if people are not careful with eustachian tube, those who are having eustachian tube malfunction, this could be a potential issue. So I would say tilt forward, downward, to the side, make sure the water is coming out. If the water is not coming out, stop, check what is happening. If it's still not coming, try another day. It has happened initially. I've had that. Sutra Neti, you have a lot of that. Often it just doesn't happen that day. Don't worry about it. Don't keep poking, and then you end up with tissue that is inflamed. Just leave it that day. The next day it's easier. I've had some very negative experiences with Sutra Neti, which is why I'm very careful with it. We had a doctor, a physiologist, who had chronic running nose. And we had a yoga teacher who was too enthusiastic about Sutra Neti, took her in. She had never done yoga before, nothing, put the tube up her nose. She had to take off 1 week because her nose was so inflamed and clogged up for another 5 days. And after that, if I just say yoga, she runs the opposite direction. And it was introduced in such a wrong manner. Come to me, here, put it up your nose. No, you don't do it that way. So again, it's the way it is done. So yes, Ananta Lakshmi, I would say one should be careful, because any practice should be done with carefulness, mindfulness. If the mind is not there, it is not yoga. Mindless yoga is not yoga. Mindless yoga is not yoga. But of course, the goal of yoga is to become mindless, or rather transcend the mind. Chitta vritti nirodha is transcendence of it. There's a big difference between muda, which is the dull mind, and niruddha, which is the transcended, controlled mind. So I think we have to be careful there. And as Sridevi puts, gravity does great work. There's a question about the spout, the length of the spout with Neti. I don't think it really matters. I don't really think it matters. I think it's more about people getting into designing and, you know, wanting to put diamonds on the spout and things like that. It doesn't really matter. I'll tell you, the spout doesn't really matter. There should be enough of a spout to get a stream of water. The spout should be long enough to get a stream of water, which is why you need a spout. But if the stream of water is there, it's more than adequate. And yes, Sangeeta, I will bless a batch of salt and all that and send it to you. And definitely not chlorinated water. Yes, Jnana Sundari, fluorinated water is a major issue. And yes, accumulating Lavana Karma, that's a good one. And yes, as Michael had put in Neti with the Mooladhara through smell, as we said, the different pranavayus would be coordinated there. I'm just going to go over and share Swamiji's page on this, because Swamiji goes a step further. He goes a step further when he talks about nasopharyngeal health, and he takes us into a level that is even more important for us to understand at this context. So I'm just going to share the screen. Nasal cleaning yoga style. This is part of what we had looked at on Sunday, but I wanted to take a bit more time for it today. Cleansing of the nostrils is an important part of yoga practices. Perhaps no part of the body suffers more from congestion as does the nose, nasal passage, throat, and lungs. Although nature has given us a marvelous cleansing mechanism, it seems that modern man, yes, the modern human beings, we have to make a mess of it, and it does happen. We do everything possible to interrupt the natural cleansing process. Polluted air from factories, industrial waste, carbon gas poisons from automobiles and trucks, and the perverse habit of cigarette and pipe smoking. They are major factors affecting nasal health. And even the sincere yoga student will find it difficult these days to find clean air to breathe. 50 years ago, Swamiji, it's not better. You have enough people denying climate change. What do you do with all of these people? Seriously, it's in your face, and we still deny that which is so clear, so clear. We just refuse to see. We are worse than the cat that closes its eyes and think you don't exist. The residue of polluted air irritates the sensitive membranes in the nasal passage, clogging up the pores and cells of the nasal vestibule and the lungs. The cough and sneeze reflex. Please understand, the coughing and sneezing are natural protective reflexes. They are called Upapranavayu. Naga, Kurma, Krikara, Devadatta, Dhananjaya. These are protective reflexes to help us. But what has happened is that we keep on blocking this. We keep on suppressing it. And then the system gets more clogged up. These push out the dangerous pollutants. But still, some of this starts to stagnate. This is where the Anunasika clears up the problem. But then you can use the nasal douche termed Neti kriya. So here the lukewarm water, Swamiji has talked about it. Milk, curds, we have talked about that also. And then again, Swamiji's version is where you actually sniff it up. And this is sort of one of the ways it would have started. As we said, the Vyutkrama and Sitkrama Kapalabhati we talked about is actually very similar to what is done here. And the sniffing action, in the video I've tried to give you with the sound, where you actually have that sound as if you're blowing into water. As you actually use these muscles to actually pull the water up. It's a very active process, as opposed to, a passive process that is otherwise done. And the water is allowed to flow through the mouth into a sink or container. And then Swamiji has suggested again Dharmic Asana, where you can get it. And then he's even suggested some dancing. You stand on one foot and jump up and down, like you clear the ears of water after swimming. So a bit of moving up and down just to change the position and unclog water that is stuck. Remember those concae that are there? Those concae, there's going to be a lot of stuff. He then talks about the Jala Neti using a lota or pot, copper or stainless steel, china, teapot, all that we have talked about. And Swamiji feels that the sniffing up style Neti, where the muscles are brought into play, he feels that is more important, because you are actually doing an active process. And definitely, yes, it's an active process. It's a bit more tough. And it has the problem that you may get water into a place you don't want. But it is actually very, very beautiful because you're using these muscles in a different way. Then here, if you're using the pot, we have talked about using gravity so that it can flow. And then use of milk, buttermilk, honey mixed with warm water. Swamiji has suggested for spore or fungus infections. This is a very interesting one because honey is a natural antiseptic. And so definitely as an antiseptic, an antibiotic. Honey is a natural antibiotic and antiseptic. So it's a very interesting use he has suggested. Herbal infusions to clear up polyps, ulcers, and growths. Of course, Ayurveda uses all sort of stuff. I don't suggest any of that to be used without medical advice, especially mercury, sulfur, and other base metals that are used in a very, very controlled environment. Everybody jumps up when they talk about Siddha and Ayurveda saying, oh, heavy metals, heavy metal, heavy metal. It is used in a proper way. But because we don't understand it, we immediately jump on people in Siddha and Ayurveda who have been using it for thousands of years with great success and safety also. And then Swamiji has suggested olive oil. So for those of you in Europe, olive oil is another suggestion he's given. Ghee, clarified butter or olive oil for the tissue if there is bleeding or roughness. And then Sutra Neti is also talked about how it can be done. I'm just trying to find, there's one more bit here. Just give me a moment. Yes. Where Swamiji talks about the eye and the ear and nose. Where did that go? How did I miss that part out? Yes. This part. Ear and eye cleansing. This is what I was mentioning a little earlier. The Chakshu Mala Dauti Pranayama and Karna Mala Dauti. So Dauti as a cleansing here. Mala is the impurity. So Karna Mala, I told you, after you have cleansed the nasal passages, not when they are clogged up. Please don't do this if your nasal passages are clogged up. Unclog them first. Once they have been unclogged, you hold the nose. Okay? Take a deep breath and close the nostrils so no air goes into the mouth. So you keep the mouth closed, nose closed, and you're going to sneeze like, and you open up the ears. So before doing this, make sure your nasal passage is clean. Otherwise, you have just very, very beautifully, congrats, spread an infection from the nose to your middle ear. So it is very important you understand there's a step-by-step approach here. Then another aspect, and then he said, cup the hands and push the air. Where did the other part go? This then is taken forward for the eye cleansing. Now the eye cleansing, what you have to do is, it's a bit difficult. You have to close the nose, the mouth, and the ear. Now I'm trying to remember how we closed both ears, but maybe you put a hair clip here. So what you have done is, after you have cleaned the nose, oh, it was with this, Jnana Sundari. Oh, see how stupid of me. Oh my God. Thankfully, I have my yoga aunt Jnana Sundari in class. Yes, you close your ears, you close the nose, basically like doing the Shanmukhi Mudra. And then what you are doing is you are blasting. So the same thing. You are blasting, and now the air cannot go through the nose, mouth, or ears. So the eye passage, remember the nasolacrimal duct? You have just opened that up by this force. That is why it is called Chakshu Maladauti. But I cannot stress it enough. Nasal cleaning first, ear cleaning second, and then the eye cleaning. Otherwise, congratulations, you now have an eye, nose, throat, ear infection. Okay, and God bless you. So first, do the first things first, okay? Nasal cleansing first, ear cleansing second, eye cleansing third. So you are doing the Neti, Karna Mala Dauti. Karna is the ears. Mala, impurity, Dauti, cleansing. Then Chakshu Mala Dauti is done after that. So these are a step-by-step practice. Swamiji used to talk about EENT, eyes, ears, nose, and throat. That is how he used to put it together. Not just ear, nose, throat. eyes, ears, nose, and throat. EENT. It was a very interesting point he used to make about that. And as Jnana Sundari again has reminded, 6 days for each in succession. You know, like that 6 days we did for the Anunasika, it would be that again that 6. And what is 6? Responsibility. I think I should unmute you and have you say a few words, because I'm sure you have a lot to add.
Yeah, I've always loved this these practices, and Swamiji sent somebody to me actually to learn the Chakchur Maradati, because you have to. It's a long process, and I've always liked Swamiji's way of doing the Jala Neti as well, because even though I've got a very nice neti pot, and I've even got a traveling one, I really like the one where you sniff in the hand, because it's active, but it depends on how my head is feeling, which one I would choose. And I think that it always comes back to what's happening in you, that you should choose the method that's right for the moment. And as I said, Swamiji said, you have to do each, if you're going to do the Chakshur Maladauti, you have to do six days just for the nose. And then I think it was 6 days, or possibly, 6 also for the ears before you start the Chakshura Maladauti. And I like to do these once a year just to keep everything going as they should. And I just love these practices. They're just jewels. Yeah. Jewels for the body and for the mind, and for the soul. Why not? We are not just a body.
I think it's so important to remember that soul part. It's so important, because we often get so stuck with these practices and the body.
Yeah, we forget that. I always like to do the draining. I find very important as well, because I've got one sinus that's particularly intransigent, and it tends to, it's this one here. It soaks up lots of water. It's incredible the amount of water I can get out of that one if I try. And if I don't get it all out, it's a disaster. And I've noticed that in books and things, they don't bother with the drying. And that's extraordinary. You do your laundry, you don't put your clothes on straight away, you dry them. And you have to dry them, otherwise you get the most appalling headaches. And worse, I haven't had worse, but I've had the headaches if I haven't dried it thoroughly. So I'm very fussy about the drying. It takes longer than the washing, in fact, for me to dry. And going upside down also is really helpful. Dharmikasana is good, or just, Padahastasana also, where you could really get a drain going, but the head's like, actually that would more like Agrimasra asana, I would say, probably the best, because your head's at the right tilt, but you're leaning down. That's
what I like to do usually is, go into like a sort of one of those modified versions. You keep your legs spread apart, and you take your hand to the opposite side like a modified trikona. So when you go to this side, you're tilting here, and you go to this side, you're tilting here. So you have that dynamic tilting of the opposite sides, sort of creating a nice drain. And then, a bit of stretching up and down, so that anything that, needs to come out of the concave, it comes into the nasal vestibule, and then when you bend down, it comes out. So change in position of the head is very, very important. And I loved your metaphor that, you don't do your laundry and put your clothes on straight. I think that's a very beautiful message, because so many people talk about Neti, and it's all over the net. You go and look at websites, and every website has something about Neti, and you don't find this. It's sort of like you just find like one, it's like fine print. You just see, okay, do Kapalabhati after it. You just find it like a throwaway thing, and people forget that the post-Neti cleansing is actually where you are getting the water completely out. So I think it's beautiful wisdom there. Thank you so much, Jnana Sundari.
There's
Means a lot.
just using what I call the Indian handkerchief, you know, that also helps. Especially when you're, you know, if you've done one side, you'd use the Indian hanky, mouchoir indien.
Now I got a name for what I was doing in that video the other day. I didn't know that's the name you could give it, but I do that quite a bit, especially after the Jalaneti. Thank you so much, Jnana Sundari, for that. Means a lot. I would like to request Uday ji to just make a few comments, because he has given us a very, very beautiful synopsis. And I think it would be nice to hear a few words from you on this. Having taught so many people this practice, I think it would really be good for people to have your wisdom. Namaste ji.
Namaste, namaste. I mean, there is so much to keep saying, but I would only say a very limited things. One of the most important things, I think, in general that people have is fear of water entering the nostrils. So I would say that it is one of the best, because so far as I am concerned, I was lucky enough to be part of what can be called as management institutes. Okay, we were teaching managers and MBA students and things like that. So somehow, unknowingly, you know, I picked up management terms rather than just teaching yoga. So one of the terms that I really came up with is, this can be looked upon as fear management. This can be looked upon as a tool to sort of look at a situation wherein you are looking at adversities. Because by virtue of design, the way I have put it in my note, I think everybody can look at that note, because it speaks about so many things, that we are creating an adverse situation. Nose is by virtue of design, not basically designed for water to pass. We are making the nose available for water to pass with a purpose. I have come across people who do swimming. Sir, you will be surprised. There are so many people who swim, but they are scared of getting the head inside water. You know, they are the worst swimmers, if you really ask me, because see, when they have got used to the head out and they swim. But if there is a strong wave that hits them on the face, they're finished, because they have not been trained to withstand that little time that they can hold breath and just wait for the right opportunity for the head to come out to breathe. In other terms, there's also one very classic expression that I have, that I'll be writing in my book, which already has been written, is, you know, there are people who say, water is now flowing above my head. Okay, that means you are almost in a drowned state. That means you are helpless. Yes, nowadays in companies, you know, this is what is happening. The water is flowing much above your head. So what do? Water is flowing above your head, so you don't die. You hold your breath, wait for the apt opportunity for the head to come up, quickly have a breath and go in, and then the world is yours. So I would put it that this is fear management. This is training you to withstand emotions, because that is one of the cases which I have put in. I was shocked at the learning stage to come across a case. Because of shock, the nose has got permanently blocked. The person never breathed with his nose all his life, because the school was burned down and he had the kids to protect. He said, you are not going to touch the kids unless you kill me. And that emotional shock has blocked his nose permanently. I met him 20 years later after this incident. And well, I can just keep on and on and on, because Jalaneti, in fact, to me, is such an interesting procedure. And when people are scared, you know, people start crying, oh no, this is happening, that is happening. You just tap your forehead a bit. You need to relax. It's one of the most classic biofeedback techniques. If you are not relaxed, water will not pass. So in fact, there was one management school in Pune called Tata Management Training Center. where the House of Tatas used to send people. The director said, even if you get 1 clock hour of a yoga session with them, teach them Jalaneti. And that is how, I mean, Jalaneti became so popular with them. They said, yes, you take this nostril and learn to relax. And the moment you relax, the water passes out. And temporarily, now VIP is passing through the nostril, so mouth is made available for breathing. So that is why another term came in. Water was made a VIP. Yes, VIP is passing. So now what do? Don't panic. Breathe with the mouth peacefully. If at all you want to divert your mind, breathe a little harder. But well, and then people should be very careful. If there's severe infection, etc., they should first manage the infection. People have oozing ears, and yet people say, no, 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 it is fine with me. Don't try, to put everything under the belt of yoga where medical attention is required. I think due respect to medical attention should be given. I'm the last man to go basically against any of the therapies. What is right? Judiciously right therapies, yes, you should go in for. And I think it is one of the, and it should, as far as be possible, not to do it late evenings. I would suggest not to lie down immediately for at least an hour or two, because even if you say that you have cleared the water, a few water drops could remain, and you may land up carrying a cold. You don't have to be upset. You may have a mild, heavy head. In lighter terms and management scenario, I say it as if, you've had a peg. Okay, so if people say, no, so if I do Jalaneti, I don't have to consume alcohol. I said, yes, yes, if that solves your problem, I have no problem. Okay, so that slight heavy head, a little oozing nose, well, it may be there for an hour or two. Post-swimming, this is what happens. We keep allowing the secretions to travel out. Keep a hanky, spare hanky with you for that day. Especially for a newcomer, it is essential. And don't immediately lie down. If you're in a place where there is a blowing fan, I would suggest don't be below a fan. Best is, like you have in South or even in North, you wear a turban, just protecting this area a bit, because you have, in a way, played with your nasal mucous membrane. I think I can keep on, but thank you for allowing me to share. And I would say that basic handout is there. So basic thing is emotional management, fear management, let things happen, let water pass over the head. I'm going to survive beautifully. I will breathe in, hold the breath, and wait for the right opportunity to breathe in. That is the best message that I can give. And it's a fantastic technique for letting the Ajna Chakra truly come into play. Thank you, sir. Thank you, everybody, for patient hearing.
Really, really appreciate that, Udayji. Nothing beats experience. And you can just see the many decades of teaching and the experience coming through, those words of wisdom. And I just love this concept of dealing with fear. And I think, again, your story about feeling like you have had a peg, so you don't need to have a drink. Maybe that's how that addiction part that Swamiji talks about comes in, how it deals with addiction. Maybe it satisfies something in the person, and then they don't go into that substance that was giving them that high that they're getting through it, or whatever it be. The other thing I was just thinking as you were talking was maybe the potential in post-traumatic stress disorder. This is just a point that just came up to my mind because, as you said, the water in the nose is actually helping us deal with something. And it would have to be done in a very safe situation, of course, because with post-traumatic stress disorder, you have to be very careful and create a safe, welcome, loving atmosphere. Otherwise, you could end up with a lot of issues. But I was just thinking that some of these things may actually be good to deal with past traumas, hidden fears and anxieties and phobias. It would actually be very interesting because what you pointed out is the nose normally is only associated with air and smelling and never with water. So here you are actually challenging your whole system in a very different way. So I think you have given us a lot of seeds to plant and grow. So thank you, Udayji, for that beautiful wisdom. I love you so much, and your wisdom is so beautiful. And we have had your wisdom today. We have had Jnana Sundari's wisdom today, and so many here. We have a galaxy of people. I was just thinking this morning, because I was thinking of 4 of my yoga aunts today. And then I just suddenly realized, we have such amazing people in this team 52. Oh my God, such amazing people that I'm like, each one of them could be giving a 2-hour session based on the experience and wisdom. And maybe that will be a future plan to take that forward, because it is just quite astonishing. So thank you so much, Udayji. Thank you so much, Jnana Sundari, for those beautiful additions, pearls of additions to whatever I have been putting together today. So I gave you like the potatoes, and they added the butter and spice to it to make it a palatable meal. But thank you everyone for taking time to be here today. These extra sessions are just to add something to what we are already learning. Because when we were doing it the other day, I felt we had not given enough time to this. And I said, no, we need to have a separate session. You have the video of a demonstration to go with it. And just keep working on yourself. And we are a team, so let's work together. Om Loka Samasta Sukhino Bhavantu Sarve Janaha Sukhino Bhavantu. Om Shantihi Shantihi Shantihi. Om. So have a wonderful time, and see you all later whenever we meet again. Next week, there's a lot of stuff coming up. We have Shivaratri coming up. So keep you updated on all the stuff happening. So have fun, and be the best you. Tata. See you later. Bye.